This segment of Delmarva Life is brought to you by Peninsula Regional Medical Center.
Well, you hear the word diabetes, what comes to mind? A disease that's caused by eating too much sugar, one that impacts people who have issues with their weight. Well, today we're taking some of those misconceptions and urging you to toss them. We're getting down to the basics when it comes to diabetes. And here to help is Kelly Birch, a registered nurse and certified diabetes educator at PRMC. Thank you for being here this afternoon.
Oh, thank you for having me.
Interesting thing about this is you're actually living with type 1 diabetes. Tell us your story.
I am living with type 1 diabetes. I was diagnosed at about the age of 19, and I've had diabetes now for about 34 years. The really nice thing about it was, or is, it's not easily controlled. It's very difficult, but at the same time, we are much more able to control it now than we did back, even 30 years ago. My mother was 3 when she was diagnosed. She passed away at the age of 33.
Oh.
And I think that's what has given me my goal. Let's see if we can keep people healthy with diabetes, because obviously we can.
It's become a passion for you.
It has become a passion.
So when you were 19, how did you know? Did you have symptoms?
I did. My uncle, who also was diagnosed with type 1 diabetes when he was about the same age, noticed that I was drinking a lot at my grandmother's birthday party. And he's like, we might want to check your blood sugar. And I'm like, oh, okay. So we went back to the house, we checked it, and it just read high, which means it was pretty high. So the next day I went to my doctor, and he gave me some insulin, and he was an older doctor, and he didn't really have any education for me. He just gave me some insulin and some syringes, and kind of told me how much to take and how to mix it. And I said, okay, and that was pretty much the education I got.
Okay.
So I can really see a benefit of what we do here for our patients with diabetes.
Okay, so you had type 1, and there's type 2. What's the difference between the two?
They say, well, right now our best theory for type 1 is it's an autoimmune disorder. So basically our own immune system attacked our beta cells. The beta cells are the cells that produce insulin or make insulin. So a type 1, it pretty much immediately has to go on insulin, because there's nothing, no insulin on board. With type 2, that's a little bit different. A lot of risk factors for type 2. We talk about being overweight, being over the age of 40, having a history, family history. And even different ethnicities. Having a history of high blood pressure or high cholesterol puts you at risk for diabetes, for type 2 diabetes.
Okay.
So many risk factors for that. But if we take a look at it, that can be prevented.
Right, so because there's pre-diabetes?
There is pre-diabetes, and that was kind of unheard of back in the day, but we do have some labs now that we know where a person has pre-diabetes. If you have an A1C between 5.7 to 6.4, you're at the pre-diabetes level, and an A1C is a lab your doctor can do to let you know whether you have diabetes or you're at the pre-diabetes or not at all. Also, a blood sugar above 100 fasting now is saying that you are at the pre-diabetes level. So many folks out there, about 83 million are walking around right now in the pre-diabetes world.
So when we mentioned misconceptions about diabetes, I mean, I remember when I was a kid, my mom would say, don't eat too much candy, you're going to end up with diabetes. That's not necessarily true, is it?
It's not necessarily true. Again, we went over the risk factors. But they are saying there's more studies out. Every place in the area has sweet tea. You go to any restaurant now, there's sweet tea. I've never had sweet tea. Growing up, my grandmother made tea and we put lemon in it. And maybe because my mother did have type 1 and my uncle as well, but we're drinking a lot of sugar drinks, sodas, fruit juices. And when I was younger, I don't know if you remember, but my grandmother had these little tiny juice glasses.
Glasses, yes.
Right? That is a serving of juice. 4 ounces of juice is a serving, not 12 ounces that we're doing now. So unfortunately, we are drinking more and more sweets and eating more sweets. They're not saying it's a cause, but it can now put people at risk.
Right. And specifically with type 1 diabetes, weight
isn't usually the issue. When I was diagnosed, I was 97 pounds. Obviously, I'm very healthy now. I've got my diabetes under control, and all is good. But weight is not usually the issue with type 1. However, people with type 1 are living longer. We are learning that we can eat all of the same foods as everyone else. You know, years ago they said, oh, you can't have white, you know, anything white, no potatoes, no flour. Now we know that everybody, type 1, type 2, we're all included, can have the same foods as everyone else. It's really about moderation, portion control, and managing the blood glucose, which in turn sometimes will cause some weight gain.
Right.
You know, but again, we also want to recommend exercise, you know, eating, again, portion control. And I think in our country, that's really a difficult thing.
Yeah, in our country. And then let's talk specifically here on Delmarva.
Yeah.
Is it common here, diabetes?
It is very common here on Delmarva. A couple years ago, it was about a 7%, I guess, prevalence in the United States. And here on Delmarva, Worcester, Wycomico, and Somerset counties, we had a 14%. Now we've actually gone up for the whole incidence of diabetes. It's now 9.4% countrywide. 1 in 11 Americans have diabetes.
That's incredible.
So I guarantee, besides myself, there's probably at least one other person in this room
who has it?
Who has diabetes.
I have a friend who has diabetes, and she actually has, like, her phone was going off when we were having lunch the other day, and she's like, oh, my sugar, or whatever. That is new technology.
Oh my gosh, it's amazing. We have something called CGMs, continuous glucose monitors. Actually, they're advertising some on television now. You'll see the people that are wearing it on their arm, and they're doing a little scanning, you know, and they just know their blood sugars are like 126. There's also other ones that you can wear in different places of your body, and they do report to the phone. I have one also, and when I came here they said, oh, could you please make sure, you know, you turn your sound down on your phone. I'm like, well, I can do that, however, but if my blood sugar drops less than 55, everybody's going to know. If my blood glucose goes over 200, everybody's going to know. You can't silence those.
Yeah.
But it's amazing the technology that we have out there. The newest CGMs, you don't have to do any finger sticks, you know, checking the blood glucose.
Yeah.
I saw that earlier on the screen. It had, you know, the finger stick, you know, in the blood. You don't have to. I haven't done one in 4 days.
Well, that's wonderful. And you're actually having an event that's coming up where people can learn about all of this, about the technology, about diabetes.
Yes.
Tell us about that.
Well, just so everybody is clear, this is November is Diabetes Awareness Month. It's an amazing month for me because we really want to get the word out. Let's keep people healthy with diabetes. Let's do what we can to just get our community healthy and on board. So every November we have an event featuring Dr. Snitzer, who is one of our main endocrinologists at Peninsula Regional. He's been around for a long time. He was the only one out there. So we always joke around. We're like, oh, he's a superstar. But we do get a nice crowd. We're having it at Peninsula Regional Medical Center. You can call our number. I don't know that it's on the screen, but it's 410-543-7061 and RSVP for that event. But it starts at 5:30 p.m. on November the 12th. We will have vendors, exhibitors, people.
Free flu shots?
Free flu shots, yeah, even free flu shots from 5:30 to 7. And some of our vendors are the insulin pump companies. We will have all of the CGMs, or the continuous glucose monitoring companies, available to talk and, you know, just kind of show what's going on in the world of diabetes. So it'll be a really fun event. So please come.
All right,
Kelly. I'm looking forward to seeing everybody.
Yeah, Kelly Birch, certified diabetes educator with PRMC. Thank you so much.
Thanks for having me.
Very interesting. Yeah.